So my name is Dr Ridwanah Gurjee from the University of Central Lancashire. My current role is Associate Dean for Community and Social Care in the School of Health, Social Care and Sport. And in particular to public engagement, my role has been heavily involved in the Centre for Volunteering and Community Leadership, where I was director for the centre for a number of years, as well as involved in public engagement activity.
That's perfect, thank you. And I suppose so in terms of that sort of aspect of your your work around the public involvement and engagement activity that you've been involved in, I suppose, is there a particular activity that you've undertaken that springs to mind that you'd like to talk to us about in terms of kind of the purpose of that activity and who it kind of involved?
Yes, the one I'll focus on is my recent engagement, international experiences with several charities in Morocco. So these partnerships developed 10 years ago, it will be next year, since we've been working with them, and they developed from initially in terms of supporting our students in gaining a global experience with working with marginalized groups from a global context. And so these were orphanage centres, with homeless people and street children, many of them of the young adults suffering from alcohol and drugs issues, and it was an opportunity for our students to gain some global experience and volunteering experience from these opportunities. And then this is now developed into research collaborations as well now.
That's fantastic. And I suppose in terms of those research collaborations, what kind of aspects has that kind of evolved into, if it's okay to ask?
Yeah, so we've been particularly focused on looking at the impact of international projects and opportunities for students in a HE context. And we've been looking at the learning and development and the impact, the learning and development for HE students, as well as the impact our students are making for the organisations and young people abroad.
Brilliant. And I suppose in terms of things that work particularly well, or particular barriers that you've experienced, with your processes around these kind of activities, are there anything, any kind of specific things that spring to mind that, within your experience?
Yeah, I'll start with the challenges. So funding is always an issue in terms of developing such projects. I mean, online activities has really been supportive, but there is a huge language barrier, and so I found some of the interviews and the group chats that we've had have been better face to face with an interpreter there rather than online. And the charities and the organisations that we also link with also depend on donations and charity fundraising activities, so they're very limited in terms of resources that they have in terms of computer access and Wi-Fi. So it's always a matter of ensuring there's funding available for the visits. We've established a recent link with one of the universities in Morocco, and hoping to develop an exchange project with the University of Central Lancashire. But again, it's all dependent on funding to ensure that the collaborations continue and the partnerships are successful.
Yeah. And I suppose in terms of kind of things that have worked well, is there anything in particular that springs to mind?
The students absolutely have had such amazing feedback from the students. They've talked about the life changes and life experiences that they've had in these collaborations and these engagements, and that kind of feedback, and the feedback that we get from the organisations, and their commitment to always hosting us and supporting us every time we visit, allows us to make sure that there's a strong, it's developed that really strong relationship between us and strong bond. And the university has been quite supportive of that relationship, and supported us in funding towards that. So we've been very grateful, but we're really mindful that we need to ensure that there are research and publications out there to highlight the positive aspects of this collaboration, which will be significantly important in securing further funding and commitment.
Yeah, and I suppose obviously some of those aspects that you've covered there, when you're thinking about sort of any key lessons that have been learned from your experience, is there anything kind of additional to what you've kind of mentioned there, obviously?
Yes, you prepare yourself with a complete schedule of how our visits are going to take place, and then there's always a spanner in the works. So there's transport issues at times, and difficulties in terms of an interpreter at times, or understanding at times. But we've always got to kind of be mindful of such issues, and Google Translate has always helped. It's gone a long way for us at times. And most recently, some of our recent interviews were completed through Microsoft Teams, and were transcribed through Microsoft Teams. And so that's been really useful to also use as part of some of the interviews that we've been completing as part of this research.
That's fantastic. And I suppose obviously there's quite a number of aspects that you've mentioned there, and if you're thinking about kind of more generally and looking at kind of potentially, would you identify one of those as kind of the biggest challenges that face kind of meaningful public involvement and engagement activity, kind of specifically related to health research? Is there a particular one thing, or is it a couple of things, and how might they be overcome?
I would probably say the language barrier is probably the biggest challenge and the major issue in terms of ensuring that communication is as effective as you to make sure that your projects and your research is successful, and also in understanding, especially when you're completing interviews. I often felt that the individual that we were interviewing was saying a lot more than what the interpreter was saying, and so it would be really helpful to kind of ensure that we're able to transcribe from all different languages.
Yeah, that's great. And then I suppose if you were talking to somebody who hadn't done public involvement and engagement activity before, do you have any top tips for someone who might be starting on that kind of pathway around public involvement and engagement for health research, sort of for the first time?
I would say that it's really, really important not to dismiss it, and to keep persevering in, there will probably be many obstacles that you face in terms of public engagement activity, but it's just so important for the in academic integrity and research that we involve all different voices into the research process. So keep persevering would be my advice. Patience, again, I would say, is really important when you're involved in any sort of work like this, and just being mindful of people's experiences that could be very different to yours, that are just so important to listen to.
Yeah, that's great. And the last question is just around kind of sustainable public involvement and engagement activity. And obviously you've mentioned some really important aspects there around funding, and also, you know, the importance of kind of developing those relationships with the organisations that you are carrying out, you know, that involvement and engagement activity with. I suppose, would you have any other tips around sustainable public involvement and engagement activity?
Yeah, one of the things that we were always really mindful of, especially when we started this as a student-led project, we were very mindful of just visiting the organisation for a week and then coming back, and then there is no engagement after that. And so we were really, because I was really mindful of that fact, I ensured that the contact and the communication was ongoing throughout the year. So there's lots of messages, email communications that we have ongoing throughout the year to support us in ensuring that we have planned for the next academic year in advance. And we know exactly what projects are going to take place with that organisation, and have a clear plan and preparation in advance to the next visit and to the next project. And so I think it's just really ensuring that if you do plan that in advance, then it really supports you in making sure that you have that sustained contact and communication. You're able to think of different ways of funding projects like this, and you're also able to kind of get new students on board, talk to students that want to be involved, and get different perspectives of what we should do, and also link with a lot of the organisations in the UK who want to be part of the project, because, you know, with my various different links in the community, with, for example, a local secondary school and a local youth group who are also really interested in developing their young people's experiences through, you know, from a global perspective, and you know, talking to them, they would like to partnership with us as well in the future. And so it's kind of developed more partnerships that are now working with the charities in Morocco. So it's really good to see. And our recent visit also, we raised nearly £2,000, and we took nearly 3 suitcases full of clothing donations and you know, shoes. And so it's just, it has been something that we feel we are kind of, by ensuring we do all this fundraising on a regular basis, that are then donations that go to these charities, has ensured sustainability for the future.
Yeah, you're having that wider impact. Yeah, that's fantastic. That's all the questions that I had, but thank you, Riz. It's been really lovely to speak to you today.
Thank you very much.
Thank you.